Dr. Analak from theGentlDentist.com in Shelby, Township, Michigan. Our phone number is 586-247-3500. And today we have our patient Maria. She's agreed and allowed us to video this and put it on YouTube. And what we're going to do is we're going to be actually placing a couple of implants today. She's got something in her mouth right now, but basically we've had issues before. We had to take a tooth out before, and we actually had a fixed bridge that was done. And you just felt like you had a sucking motion. You just couldn't get used to having a bridge. So if we come on over here, I'm just going to point out a couple of things. First of all, this is a molar tooth that we had to remove previously. We did a bridge. There was a tooth here, but we did a bridge on this before, and she just couldn't tolerate use it. So now there's no tooth here, so we're going to put an implant here. And also on her left-hand side of her mouth, we're going to place an implant here. So this is the right in the lower jaw. This is the nerve right here that transversus comes down into here and into where the nerve that gives sensation to the teeth and to the lip. And so, but we're going to have adequate space here to place an implant in, so in both areas. So we're going to be showing that today. Dental implants are one of the two of most requested ways of replacing missing teeth in dentistry, and so we're going to do that today. And I know you're excited, right?
Oh yeah, that's a first. The bridge that I couldn't tolerate, right?
Yeah, yeah. Well, sometimes it is and sometimes it isn't. And for you, that was what we tried to do first, and then obviously that didn't work for you, so we're going to do the next procedure.
So you know, the top one worked great.
Yeah. So sometimes people have different abilities. On the lower, you have your tongue that's there, and your tongue sometimes creates that vacuum, and then that's where you get that feeling. So it's just different for different. So we're going to go ahead and do is we're going to create a little incision here, and she's numb. She says she can't tell if she has a chin or a tongue. That's a good sign. And so we just create a bit of an incision here and come down. And then we're going to expose this area just like we would I like to use the analogy of a banana. It's like doing a banana peel. And so we're just going to go ahead and yep. So what we do is we just take this tissue back. And she's numb, right? So she just feels pressure. As she's breathing in her gas, she's a happy camper. So we're going to go ahead and I clean everything out there. So now we're ready to just start putting little holes in there for the implant. And so, come over the top of me here. And suction right there. Good. And so this is the space right there. Can you irrigate, please? Good. That's good. You can see right here is the bone. There's the bone right, if you can see right here. And then this is the hole that we're going to end up putting the implant in. All right, too much. So this is the implant we're going to place in there. I actually placed some hole, called osteotomies in there, and the implant's going to be about this long right here. Okay. We did remove in the past we removed a tooth there, and so we have a kind of a large space that's there, and the larger diameter of an implant that we can place, the better we are. The larger it is, like I say, the more that we can it emulates a natural tooth when we place it in. So we're just going to put that in, and we're going to actually torque it into place with pressure. So if you turn it off now. Okay. So we went ahead and made called the osteotomies in her mouth, and so now we're going to place an implant in. This one here we're doing on her left-hand side, and I wanted just to record this portion, just to see as we concluded. Go ahead and suction, please. So now we got basically a hole in there. And within that context of where that's going to go, we're going to have our implant is going to go. Actually, this is a little different style. It's called a bicon, and it's actually press fit, and we actually will tap it into place. And if you can see right there, see over it, it's going to fit right inside that little hole there. And then bone is going to end up growing inside of those little fins that are there. Okay. And so what we do is we're just going to place it in here a little bit, and then a lot of pressure. Good. Now I'm just going to go ahead and remove. You understand? I'm going to go ahead and remove this little black element. And with that, and then we're going to seat that in a little bit better. Can you go ahead and suction again, please? Okay. There we go. Thank you. And so I'm just going to remove this right now. Okay, so the implant's in there, and we're just going to seat that down a little bit, actually with a little mallet that we use. And as Maria's biting down, use this. And so what this does is just, we need to get this nitrous stuff. So what we're going to do is we're just going to press fit that in, and then over time, those fins that are on there, if these represent the fins, bone is going to grow inside of each one of these fins, and it's going to create a nice stable foundation for her. So it's just going to fit like that. You're going to feel a little tapping sensation as we tap this tube. And it just takes about 3 months or so for this to heal. Here, take that and let's suction. We'll kind of give you an idea and show you what we're talking about here. So there you go. So now we got the implant in place. You can see that. See it right there. And then inside of that little well there, we're going to create the crown. And so we're going to stitch her up, and we'll see how it goes. There's actually some bone that we got when we created the little hole, or osteotomy as we call it. And I'm going to place a little bone around the opening of this. As we allow this to heal, that will create a much better healing environment for the other situation. And actually I'm going to use part of this bone for the other implant site that we had done. So we just come over here, straight over the top. And so we're just going to just pack this bone into where the hole was. Now that implant's sitting in there. Now we're just going to put a stitch this up. Okay. With the bike hole. Just wait. There you go. Okay. Are you recording? Okay. So we're going to go ahead and we're putting, okay, relax that. Okay. Okay, we're just putting a stitch in here. We're going to close this up so it's going to have a good seal. Sometimes we will try to create a tooth in function at the time that we do the surgery, the time that we place the implant. The fact that this is a molar tooth back here, we need to get a lot of strength for that. If it was a front tooth, and molar teeth actually take a lot more stress than a front tooth would. So, can you go ahead and cut that? Okay, good. So we're just going to do that. And also this system where we do the press fit system like you just showed you, that it actually creates a very, very nice result. But we don't actually do it right away. And the benefit also is that these implants can be very, very short. That is the reason why I use those in this scenario for Maria. We had actually, we always contend, like I showed you at the beginning of this video, we always contend with the fact that the fact that the nerve is there. And when we do the top teeth, there's always the sinus membrane that's right there too. So we have to be very, very cognizant and aware of all of our anatomy. That's there. And so sometimes these short implants, like this Bicon implant that we're using, we need to use the short ones. Also, another issue that we have with the lower jaw is near the tongue. There's like a concavity there, and whenever we go ahead. Whenever we place an implant in there, we have to make sure that that implant is completely surrounded and encased in bone. Sometimes, like this situation, it was imperative that this one that I'm currently doing this was an area that didn't have any teeth there at all, so bone filled in here very nicely. Since her right side, which is the first implant we started, that one was actually a result of, can you suction please? Where that one was, where that implant was placed, because the bridge, she just had a hard time talking. Yep. There you go. Where we did that, it was there was still some areas where the bone hadn't completely healed in there, so we had a little different scenario. The nice part is where all the bone was in this case, on this on her left side, we had a lot of good healthy bone that we could actually save, and we're going to actually, when I get done putting these stitches in on the other side, I'm going to go ahead and just pack that bone all around where that implant was placed, to create a good environment for bone to heal well in there. So, okay, go ahead. So that's over here on this side here. Okay. Go ahead. I'll stitch that up a little bit more on that side, but I want to get to this other side first. So doing great, Maria. Okay. I'm sure you still feel like you don't even have a lip anymore, right? Okay. Okay. I'm going to go ahead and put this bite block in your mouth. Okay, bite down. That'll help stabilize your jaw. And so if we come over on this side here, we're going to have a little bit of a space. So let's see that bone again, and I'm just going to pack that bone that we got from her other side, and I'm just going to pack it right over the threads of, or over the top of that one implant there. So just go ahead and suction right there for me, please. That's good. Okay, so we're going to just place this in here, right over the top. I'm just going to pack it right in there, and then it's going to help that to heal up. And then we're going to stitch that one up the same way that we did. Okay. And we create this little stitch over here. What is nice about that is sometimes you can get discomfort from the way that the soft tissue is handled if the gum tissue is so this is really actually a gentle way of handling it, because we're not getting in there and pushing our instruments all under the flap. It's just actually, if I pull her cheek, it comes back naturally for her. So, alright, so we'll do that. A little bit more left here. Thank you. I think that's it, eh? Alright. There you go. We're just going to put that in and stitch her up. Here we go. See, now as we take this stitch out right here, which we started off, this whole thing's going to come right back. And it will heal with literally within a week or so. It'll all heal. So it's all going to go back nicely right over the top, just like that. We're going to stitch that together. Okay. So we went ahead and finished up. We finished stitching up both left and right sides. We're going to end up on that right side since she had a fixed bridge in there before. We will go ahead and cement that in for her. Cement that back. I'll show you what that is. It's right here. And this part right here is a place where the tooth was replaced, the implant was placed. If we come up here to the x-ray, this is the x-ray of where she is now. This is the implant that's been placed. This is the tooth that has the 1, the 2. So normally this bridge is going to fit over the top of it like that. She couldn't tolerate getting stuff through here, so now we're going to end up taking this eventually and cutting it off here and cutting off there, using these 2 crowns over this and then placing a new crown on the implant. And so that's what we're going to end up doing. But this is the implant here, and that's going to heal. It'll take, that's the one that you saw, the last one we did. It's going to take around 4 months or so for that bone to really heal in there well. So until then, we'll cement this bridge back on for you on your right side, and that way you can use that. Your left side, it's the same way it's been for a number of years. You're just not going to have anything there for a little while. Okay. What we'll do in about that period of time is we'll uncover everything, and we'll place what's called an abutment on top of that, which will simulate like a tooth that's been prepared for a crown, and then we'll put a cap over the top of that for both sides, so you'll be able to function that way. Okay? It went really well for you. The reason why we had to switch, you asked about that right side when we first did it. She had a pretty bad infection on that tooth when we first did it, and because it was such a large hole, we had to kind of switch gears in the middle using a different implant system. That's one thing that's beneficial, I think, because we use a number of different systems. We can, if there's a situation that arises, we can switch what we do and yet get a favorable result and not have to stop what we're doing and continue. So,
Other than I feel no chin,
No.
it went pretty well.
No chin.
no chin. She feels no chin and no tongue. If you have one, it'll just about 1 hour or so from now you'll know that you
I
have
don't know
one.
that I have everything.
And what you're going to end up doing is you're going to keep ice on one side for about a half an hour and then switch it over to the other side for about a half an hour and keep switching back and forth today. Okay, I'll give you some pain medications, and then you should be fine with that, and then you'll see how you do. Okay,
All right.
How was the experience for you?
Different, once I never had something done like that before, so I think overall it was all right. It was not terrible.
Not terrible.
It was not terrible. It was not something I would go to the show for, but it was not terrible.
Well, the truth is that you're going to have to go through that one time and be done with it, and then you'll be able to function better and to chew on both sides equally and not have that issue with that sucking feeling. So, okay, so anyway, if there's any questions, our phone number is 586-247-3500. If this is some type of information you're interested, you can either go onto our website, which is thegeneraldentist.com, or call us. Thank you. Have a blessed day.